Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today I'd like to talk to you about carpal tunnel syndrome. Carpal tunnel syndrome is where you have the compression of a nerve in the wrist. Okay, it's basically what it comes down to. Now, there's lots of different causes for it, but there are a lot of different things that we can do to help it. The one thing that most people don't realize about carpal tunnel is that they feel the pain in the wrist, but the nerve that travels into the wrist originates and starts in the neck. So the interesting thing is that you can actually have this nerve compressed at 5 different places. And most people that have carpal tunnel have some form of what we call double crush. Okay, so double crush means the nerve is getting compressed further up than just the wrist, so it's getting compressed at multiple places, and it really compounds and makes the carpal tunnel worse. So we can see that the nerve that goes into the wrist starts in the neck, and it can be compressed in the neck, the shoulder, it can be compressed at the elbow, it can be compressed as it passes through muscle in the forearm, and it can be compressed here. So all of those problems can create this issue with carpal tunnel. So what we do with carpal tunnel is we try to address everything. We try to address the wrist. We look to see if the nerve may be entrapped somewhere else, and we can utilize a lot of different therapies. So really, the examination and looking at the different problems and the different points where the nerve can be entrapped is important in helping us determine what type of approach we want to take for carpal tunnel. So if you have a problem here at the wrist, but yet we take an x-ray and your neck is very degenerated, then we may need to do something like non-surgical spinal decompression therapy, which is a very gentle therapy we use in our office to help create more space and take pressure off the nerves in the neck, because it may be getting crushed here, and that may be creating problems down into the wrist. Now, we may need to address the neck. We may need to address where it passes through the shoulder. We may need to approach the where it goes through the groove in the elbow. We may need to do some soft tissue work here to free up the nerve as it passes through the forearm, and then we may need to work on the wrist. Now, there's a lot of different things we can do for the wrist, everything from very gentle stretching and manipulation of the joints to laser therapy directly on the nerve, to different pain therapies as well to help improve the nerve issue. So we at minimum we want to do a very good exam so we can figure out where do we start, what things do we need to consider, because we have to treat the entire neurological chain. We have to look at the neck and every place that nerve can be compressed. It's a big mistake to just look right at the wrist and only think that the nerve is there and that's the only thing creating problems with that nerve. If you think of it almost like a water hose, there's water that flows down, and if you pinch it above, you get less flow here, and that can create problems. So those are some of the ways that we address and we support people and treat carpal tunnel syndrome in our office. If you have carpal tunnel syndrome and you would like an opinion on your case, please don't hesitate to reach out to us. You can give us a call at 828-324-0800, and my staff will help you with any questions you may have about making an appointment in our office. If you would like to learn more about how I work with carpal tunnel and the things that we do in our office, you can just visit hickoryspine.com and you can learn more there. But I hope this helps you better understand carpal tunnel, some of the ways that we want to approach it, things we want to consider, and I look forward to meeting you soon. Thanks.